Hair loss affects men and women of all ages and can do a number on one's self-confidence and self-esteem. Hair loss can be especially devastating for patients undergoing cancer treatments. Dr. Scott Bowden is a board-certified hair transplant surgeon at Hair Restoration and Aesthetic Medicine Center, and he's joined by Jenny Proto, a cancer survivor and patient. Welcome to the both of you.
Good morning, Jocelyn. Thank you.
Dr. Bowden, let's talk about your center, Hair Restoration and Aesthetic Medicine Center. What do you provide?
The main focus of my practice involves transplantation, hair transplantation for men and women that have lost hair. Not everyone is a cancer survivor, of course. I have a special expertise in treatment of patients that have had radiation or chemotherapy-related hair loss. But my main practice does involve restoring self-confidence, self-esteem, feeling of self-image for patients of any age with hair loss.
You're also involved with Operation Restore. What is that about?
Yeah. Operation Restore is a program, it's a pro bono program offered through the International Society for Hair Restoration Surgery. I'm one of the surgeons that provides this service, and we enroll patients that have lost hair either due to burn, cancer treatment, some sort of a trauma, and they can apply for treatment at no cost that it would be provided where follicles are removed from the back of the head, reimplanted to areas of hair loss, and they grow forever.
That's a great program that you're part of then. Jenny, you're a cancer survivor.
Yes, I am.
When did you start seeing hair loss?
I had 22 hits of radiation, and towards the end, pretty much my top of my head was the hair was completely gone.
And you were expecting that, right? Doctors
Absolutely.
told you to anticipate that?
Yes.
Did you expect as much hair as you lost?
At the beginning, I was kind of surprised, but as time went by, part of the area did grow back, but the actual area that the radiation was taken from or was hitting, I ended up having a bald spot.
And that's why you turned to Dr. Bowden.
Yes.
Let's take a look at your before picture, and you can it's so nice of you to share this with us. Now, this is the bald spot that you were left with after treatment.
Correct.
And it was tough to grow hair there.
Correct. There was no hair at all.
So when you saw that,
it was difficult. I lived with it for a couple of years, and then it started really getting to me.
You actually lived with it for a couple of years before
Yes.
you sought help from Dr. Bowden?
Yes. Yes.
Dr. Bowden, what did you do for her?
Well, the treatment for Jenny was involving transplant of individual hair follicles from the back of her head where it's permanently growing, genetically stable, and meticulously taking those hairs and reimplanting them into areas where she had radiation injury. Those hairs grew. It took about 4 to 6 months before you start to see significant growth. Over the course of a year, the hair is fully grown in, and I think she's had a terrific cosmetic result. And
So it took a year to get to this point?
I think that picture was taken about 8 months after the initial procedure. The procedure is done as an outpatient. Patients are awake. It's done in the office. It's not a painful process. It's just a patient process.
I was just going to ask you, Jenny, was this painful?
No, it wasn't. It was not painful at all. I had a great time that day. I mean, we started around 8:30, and I was out of his office about 2:30 in the afternoon, and literally each hair follicle was implanted one by one, and I was having conversation with the staff. It was tremendous.
Amazing. So what happens when somebody undergoes chemotherapy or any kind of cancer treatment? Why is it that they do lose some of their hair, or most of their hair, some people?
Exactly. An important question. So chemotherapy can cause generalized hair loss. Often that'll come back after chemotherapy is completed and the patient's cancers are in remission. Radiation can target a specific area, very effectively killing cancer cells, but also damaging the blood supply to the hair follicles, and so you can have permanent hair loss due to radiation damage. Those areas can often respond very well to hair transplantation. It's a very gratifying part of my practice to be able to treat people who have had permanent hair loss and give them a sense of self back.
So Jenny, did you take part in the restoration, Operation Restore?
I'm going
Is
to
that
leave that
something
to
you took
Dr.
advantage
Bowden.
of, or?
Jenny would be a person who would be a good candidate for Operation Restore. So Operation Restore, as I mentioned, is a pro bono program.
Yes.
I'm a member that provides hair transplantation services for patients that have lost hair. We have a program coming up in honor of Breast Cancer Awareness Month. I will be offering hair transplantation through Operation Restore in the next period.
Very good. And you're also taking part in the Paint Your Lips Pink at the YOLO Laser Center and Med Spa in Guilford on October 26th.
Right, October 26th is going to be a fun event. It's going to be an event in
The information is right
there.
there.
Oh, there you go. Very good. In honor, in recognition of Breast Cancer Awareness Month, and this is an opportunity for patients that have lost hair either because of breast cancer treatment or for any other reason, cancer or radiation treatment. They can come see me, and I'll be there personally that evening.
And for more information about your Hair Restoration and Aesthetic Medicine Center, the phone number?
Okay, 860-563-1400.
And website?
Website is hairtransplantct.com, hairtransplantct.com. Main office is in Wethersfield. My main practice is now on the shoreline in Guilford as well as Wethersfield.
Very good. Dr. Bowden, Jenny, thanks so much for being with us and for sharing your story.
Thank you.